Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Welcome to Presentation Skills for Telemental Health. In this section, our learning objectives are to review studies that support telemental health's effectiveness. We'll gain knowledge of tools to enhance the client experience and treatment outcomes when engaging online. And lastly, we'll learn ways to use the client's natural environment as a part of the treatment process. When considering presentation skills for telemental health, an important aspect is to remember that telemental health is a treatment delivery modality. It's not a clinical modality within itself. It's just the way in which we are choosing to use technology to deliver clinical services. So I want to introduce us to the 4 E's of effective engagement. And we're going to dive into each of these individually, but I want you to notice with this diagram, we have to engage, that starts the process, then empathizing, that can go back to engaging or go forward to educating. We then have education that goes up or down, as well as experience that also goes up and down, and the cycle continues. It's really important for us to understand that just like the clinical or therapeutic journey, none of these things are linear or are they a step-by-step process, but we want to always make sure that we consider our clinical skills continuing to develop. And as we consider presentation skills in telemental health, we want to keep in the forefront of our mind that those presentation skills are accompanied by our clinical skills and experience. And we're going to first look at how we can improve those, see where telemental health kind of fits and where the technology comes in. And then we'll go further into specific presentation skills for this particular section. So let's start with engaging. And we know that it's the most basic and baseline experience of actively listening, engaging in our client's story as we learn about their life and experiences through their lens. We like to use the term, and we hear it often, that the client is the expert. Engagement begins at first contact, and that's something so important for us to remember. Even before we get to the typical initial consult, a phone call, or even a session, we must first consider the ways that clients even find us now. We have social media, we have websites, we have directories, we have Google. And so before we can even verbally engage a client, sometimes we're engaging through just our copy, our words, even our pictures that might be communicating a certain message as we consider the ways in which we present ourselves professionally. But with engaging at that first point of actual contact, we're building rapport and we're setting the tone for trust, knowing that this continues throughout the entire relationship. And it's starting that process of developing that treatment and therapeutic alliance with our clients. And no matter the treatment delivery model, this is something that is extremely important. This can require more energy for us to connect through the screen. Because of that screen barrier, a lot of the times it's important for us to emote ourselves more or express ourselves more so that clients can, what we say, feel us through the screen. Clients may have distractions in their natural environment, on their device. There might be notifications that are popping up and things that are happening that causes distractions for them. Or there may just be limitations of their device, which can impede engagement. We have clients sometimes who communicate that there's something wrong, or there's a disabling of their camera feature, so they can't engage through video, or there is something that is prohibiting them from communicating effectively through a written format. So we must first consider the different ways that technology impacts engagement, because it's not just our verbal and our actual physical engagement with clients. Sometimes it's the ways in which technology and the lack thereof can sometimes prohibit clients' full engagement with us through telemental health. But from there, we then have the next level, which is empathizing. And this is a very basic skill that we have clinically as professionals. And this is where we provide verbal feedback and sometimes nonverbals as well to communicate, being able to identify with our clients and their feelings. Often when we're empathizing, we are being validating. We are encouraging vulnerability. This is another one of those skills that allows for us to build that therapeutic alliance and what we call a partnership with our clients. Sometimes we have to challenge our clients through this experience when necessary and when it has their best interest in mind. Empathizing also requires increased focus to minimize the distractions that I spoke to earlier in the client's natural environment and or their technology. If there may be other people that may not be in the same room, but maybe the same home, maybe there are children or there are pets, or there are things that can interrupt that exchange of that feedback and that communication and that moment and space that you are trying to create for your clients. And it's important for us to help kind of build that scene and that atmosphere so that the clinical skills that we are trying to communicate through the screen actually come through. When we're empathizing, it also is a great time to continue to practice the use of silence, but that can sometimes be more challenging from a distance. Sometimes that can give the impression that there is some kind of technological issue, or sometimes silences just feel what we call louder when we have so many things that can cause a barrier between the client and the provider that's actually engaging together through technology. Next, with our engagement skills, we have education. And in this particular area, we're providing education, sometimes psychoeducation, and reassurance that you as a provider can actually be effective and a full support to a client from a distance. It's important for us to recall and remember that clients are coming to us from several different spaces sometimes. They may be comfortable with technology. They may be aware of the ins and outs, the pros and cons, the risks, or sometimes the limitations of telemental health services. Sometimes people may be more fearful or concerned about privacy risk, or they may know upfront that they may not have the level of privacy that they might desire. So in the education space, we're making sure that there is a full understanding of where clients are and what your role is as the provider to help them to be comfortable in this treatment delivery modality or experience that they're choosing. It's important for us to be confident also in our ability to help clients feel comfortable when using technology for their clinical needs. There's an earlier study that talks about one of the largest indications of client success through telemental health services is actually the provider's confidence and knowledge and competence in the treatment delivery modality. So that just speaks to how important it is and how we can communicate and allow our clients' anxieties to be eased sometimes when we're able to be confident, educate, and have a very well-rounded and also comforting experience with our clients. In education, we're also sharing knowledge, we're sharing tools and resources that can make distance sessions feel closely aligned when in office sessions. We're going to talk later more about some of those things that you can use and incorporate to achieve this. But sometimes we also may have to respond to clients' concerns and help them to see how the services can be best aligned when we keep an open and a flexible mind. Through education, we are communicating and exemplifying effectiveness strategies when clients may be a little nervous or unsure about the service or the treatment delivery modality. This is where we can share with them research and studies and statistics that can help them to be comfortable and show that, again, you're confident in the treatment delivery modality that's being chosen. The education also helps to reduce barriers to the utilization of resources. And we also can acknowledge when telemental health may not be a good fit. We can refer, we can provide services appropriately, and we can educate clients as to why this may not be a good fit for them so that there are not feelings of rejection or clients are not left to figure out the next stages of their support on their own. And lastly, in our 4 E's, we have experience. So each of the things that we are being made aware of and educated about in regards to engagement and presentation skills, we want to actually practice them and use them. We don't want to keep them in our back pocket. We don't want to keep them hidden because when we are using telemental health services, sometimes it can be more challenging just to sit and have talk therapy. Again, because of the distractions, maybe there are things or limitations with devices. And again, we want to exemplify how in-person services may come across through a screen. So through experiencing, we're individualizing the process and utilization of electronic resources and tools per client to achieve their individual treatment goals. We're not lumping everything together and saying, well, this worked for one client, so this should work for all clients. We're making sure that we are being very individualized and we are experimenting with different things that can satisfy clients' learning styles. We know some people learn better through visuals. Some people learn better through explaining things different ways. Other people are very large on experimentation and actually experiencing different things, getting their hands on things and being able to be an active participant in their services. Experiencing these different resources and tools also helps us to pause and consider our clients' feedback. Again, when we consider where our clients may be coming from when they're starting their telemental health and engaging in these services, we want to make sure that we're open to how things are working for them. Is a particular service or resource or tool that you're using, is it working or not? Is the client having a positive response? Are they feeling challenged? Is it going over their head? Is it too advanced for them? Are they feeling overwhelmed by some of the things that are being shared or being experimented with? So we want to make sure that we are integrating and prioritizing clients' feedback, again, so that we can set the atmosphere, build that rapport, and that therapeutic alliance with our clients that says we're listening and responding, and we're making sure that we're adapting to their needs. And lastly, as we choose and we select different resources and tools to use to increase engagement and to increase our presentation skills, we want to continue to be flexible, to be open-minded, and to also be creative, to try and do new things that we have seen to work and that we've learned can work through these particular services. It's important to know that we can't educate and make clients comfortable if we are not first competent or comfortable ourselves with tech and effective utilization as service providers. Studies show that providers' bias and comfort level with technology improves with utilization as relative advantages outweigh disadvantages. So the more that we use the technology, the more that we try different things, the more that we keep our minds open and we engage in a way that allows for us to expand our skills and to help to educate ourselves so that we can educate our clients and engage and empathize with them in a way that translates through a screen, we must first practice. And as we do that, the advantages of that, the ways that we learn to pull our clients in and to navigate some of those just natural challenges and cons that can come up with working with technology, like a service interruptions, or sometimes technology can just be fickle. The more that we practice, the more that we can prepare ourselves with how to best respond. And we can also make sure that we can balance taking care of our clients in that same way. When we don't do that and we lack strengthening and utilizing our presentation skills, and not only our presentation skills, if we think back to those 4 E's of engagement, it's really combining our clinical skills with our presentation skills. And when we fail to do that, studies have shown that there is decreased effectiveness and clinical outcomes. Clients, as well as providers, can feel anxious. Clients can feel disconnected and distracted. And we also run the risk of decreasing the impact of the rapport that we're trying to build with our clients. And confidence in our clinical skills and our experience gets shaken and decreased because we're not putting the time and investment into making sure that our clinical skills actually translate in the way that we need and desire so that our clients can have the best clinical outcomes. When we lack virtual presentation skills, they also can cause the same challenges because they're one and the same. Whether we are in office with the client face to face, or we are through a virtual setting, none of these things change. And it's important for us to remember that when we are providing video conferencing, it's the most closely aligned to in-person services, and we have the same ability to have the same impact and to achieve the same goals and clinical outcomes. And so those presentation skills in general, as well as virtual presentation skills, are all one and the same. However, when we invest in high quality virtual services, meaning that we are practicing and strengthening and growing our presentation skills, research has shown that symptomology actually decreases over time. There's a study that followed individuals who had major depressive disorder. And as they participated in telemental health services over time, they saw a decrease in the symptoms that they were experiencing. Those clients actually had fewer no-shows. Those clients actually showed up to more sessions as well. They were more consistent with their services in addition to just feeling better. We also know that we can increase the use of coping skills outside of therapy, and that there's also a high patient satisfaction and moderate to high clinician satisfaction when we provide high quality virtual services. So clients are very satisfied because they are getting the services that they need and that they desire and that they might not have access to. And then clinicians are also having a high satisfaction rate because we're able to deliver the services that we are so good at from a distance. We're able to increase our impact and our reach for clients. And we can see just with evidence and over time that the clinical skills that we have can be highly translated from a distance. So in this section, we're going to review some actual tools to increase presentation skills and increase client engagement. First up is online forums. When we consider using telemental health services, especially if it's the only treatment delivery modality that's being used, and we do not have a hybrid service where we have in-office or in-person sessions that are available as well, it's very important for us to decrease any barriers that can cause a client to not be able to easily and naturally go through our processes, whether that's our intake, engagement with homework assignments, communicating with the clinician through any kind of communication channels like chat or so. And we want to make sure that we are using resources that allow for us to do that. So the first tool that really helps to increase client engagement is the full use of online forms. We can use these to deliver assessments, consents, treatment plans, any kind of communications in regards to authorizations to release or obtain information. If we want to provide any additional forms that we might need consents for, we can deliver these always through online forms. It reduces the barriers to having to obtain electronic signatures. Just imagine the challenge that it can cause even a client who may have access to some of the additional equipment and resources. But if a client had to go on a website, download a form, they couldn't fill it out on their device if they didn't have that functionality. So they had to have a space to print that form and then have the opportunity and the skill to be able to either scan or fax, email, or mail that form back to the provider. So without the use of online forms, we sometimes create additional barriers to clients who may not have access or don't have the time or energy or motivation to follow all those additional steps when engaging in a virtual and technology-based service. So with this, the easier that we make it for clients to engage, it can increase engagement through creative uses such as journal entries. We can use online forms as mood trackers. We can track medication management, feedback forms. We can get, again, journal entries from our clients and anything else that they might want to share with us. We can create surveys and get feedback. We also can do grievance forms and any kind of other communication channels that might be important for you and the clients that you serve. The next tool that's highly effective is screen sharing. Screen sharing allows for the client and the clinician to visually incorporate resources to reference in real time. Screen sharing allows engagement of different learning styles, and it also increases attention and focus. So imagine if you have a client that you're talking about a certain intervention or resource or skill, and the client is being challenged to visualize or follow you through the explanation or education of this particular skill. How helpful is it to be able to pull up a resource, a website, a worksheet that you can share in real time as if you were sitting next to each other and sharing that resource together? Sharing the screen with the client allows for you all to go through that resource together, to ask questions, for a client to be able to visually connect what you are verbally communicating with them. It allows for different clients to be able to process better, and it also allows for them to be able to see and have a cognitive connection for some concepts that might be overwhelming without having that supportive tool. Another resource that we have is whiteboard features. This is also a form of screen sharing, but it allows for a client to engage and interact in real time and also to engage through written or visual or even drawing aspects. This allows the client and clinician to visually work together through an intervention in real time. And unlike just screen sharing, this allows for a client to have more of a experiential experience where they can get their hands and their minds connected and a part of the intervention process that you're sharing with them as a provider. It provides the ability for the client to engage, again, different learning styles and be more active in the intervention. And it also can be achieved through sharing a blank document or using drawing tools like a Jamboard that's provided through Google Drive. Every electronic medical record or electronic health record or different avenue that's being used for a video conferencing feature does not have whiteboards. And so this last component that gives you alternative ways to incorporate a whiteboard feature is really helpful when you need something else or something more that a client might need. Next, we have apps. And apps are very cool. They're very interesting, and they're becoming more and more a part of a integral component to services. Recent research and studies have shown that some clients are more engaged through apps. And there is a speculation that because clients have cellular devices, it's more at their fingertips, it might just feel more accessible or even more engaging to clients as well. But apps and using those in a creative way allows for the work that's being done in sessions to actually continue between sessions through accessible means. It allows for the client to be able to integrate and use and practice different coping skills and resources in their natural environment. So when they are in their time outside of their sessions, where I like to say where life happens and it continues to happen, they have these resources at their fingertips. There are some apps that allow for the client to share progress and updates with their provider or just a shared person, but it also allows for just great conversation starters and check-ins. Often when sessions are started through telemental health services or even in-person services, there's often a check-in where we allow for clients to communicate and show and let us know how things have gone in their lives in between sessions, anything new that's come up, anything that's challenging, anything that has stretched them in a particular way. And check-ins are structured in so many different and unique ways. But to have a client be able to have a reference that they can go back to, because sometimes it can be hard to remember everything that happened in between sessions, especially depending on the frequency of those sessions. So having a client to pull out their app and to be able to look at the data and the history that allows for them to show on this day at this time, I was feeling this, and I noticed that over time or over days, I felt the same way, or day 3, my emotions and my thoughts shifted. And on day 4, my mood and my overall presentation felt better. Sometimes it can just help clients, especially those who are navigating anxiety, overwhelm, stress, and even some mood instabilities. It helps to give them a place to just check in, to make note, and be able to compare and give accurate feedback as to how they feel and what's occurring for them. Another great use of apps and just tracking their progress over time, it can really help for coordination of care with a psychiatrist or a primary care doctor as well. It allows for full communication to be able to have evidence to show clients' feedback and reference to how they were feeling, what they were doing, and being able to have that data be a part of their treatment record as well. The very last engagement tool that we're going to go over is actually using the client's natural environment. And what I mean by that is clients are actually inviting us into their personal spaces when we're using telemental health services, whether it's their home, their job, just their neighborhood if they choose to take a walk or be in a more open setting that they've created privacy around. If it's a shared home, if it's their car, many clients are choosing to engage in telemental health services in different settings out of a need to create privacy, to have safety, and to also just be comfortable. So as clients do that and they navigate that in their natural environments, we are showing up on their technological devices and being invited into their space, however that looks and however they've created that. And I often consider and think about that as really an honor to have a client allow for me as a provider to be more invited in a part of their personal spaces. It's important for us because of this to be mindful of any rigid expectations and be open to varying meeting spaces. Maybe certain clients have pets that are a part of their services or their spaces. We want to be mindful of other people at all times because we are aware that clients might censor what they say around certain people, even children. Clients may not feel comfortable with being completely open and honest and transparent about their most vulnerable feelings when there are other people that can hear what they're saying. So, because of being invited into their personal spaces and their natural environment, we want to make sure that we're not doing too much that's dictating that space for them and that we're honoring our invitation into that space. But while we're there, it's really cool to be able to have this avenue and this new window into an environment that you wouldn't normally see. A client can't necessarily pack up some of those personal just belongings or decor or things that they have used to either decorate or be a part of their spaces, whether that's art, whether that's decor, whether that's something else that's significant and unique in their particular backgrounds. If they were coming in office with us, those are things that we miss. They're things that the client doesn't necessarily pick up and bring with them in order to give us a view into them and their lives in a very well-rounded way. So sometimes it can be helpful to increase engagement and to also increase just our skills with engaging with clients from a distance by paying attention to those things. And something that we can reference to consider to what degree we do this is really measuring and considering the rapport and the relationship that you have with each and every client. Some clients might not feel comfortable with you commenting on things that you see in their environment. It may make them feel paranoid or uneasy or sometimes anxious. But with other clients, it may make them feel seen in a whole different way. It may allow for natural conversation that might not otherwise naturally come up for them to be able to talk about certain things that you may notice in their environment. It can allow for clients to feel that the wholeness of who they are and their experiences and their interests are actually important to someone else. I think about when we are servicing children or teens or young adults, this can also be helpful and an engagement tool to become more aligned with who they are and be able to see certain things that they invite you into. So sometimes we can do what's called scavenger hunts, where we give clients certain prompts and things that we want them to find in their natural environment and to bring back to the device to share with the provider. And other times we can also have a show and tell experience where, depending on the treatment goals and the comfort of the client and the therapeutic alliance and relationship that's there, the client can go and find things that are representative of some of the treatment goals and focuses of the session and be able to communicate the importance of those things and the significance of those things in their lives to the clinician. So these are all ways that we can use the client's natural environment and really take advantage of them being in a space of comfort and having access to personal things that they wouldn't normally be able to integrate into an in-person setting to some degree, right? And so using the client's natural environment is a really key way to increase engagement and to be able to pull all of these things together and honor the space that they've invited you in.